Hi, my name is Emanuel Cruz Carrasco. I am going to read chapters 7 and 8 of the textbook Professional English Use in Medicine. Chapter 7 is about nurses and chapter 8 is about professional health, allied health professionals. Okay, I'm going to begin reading chapter 7 Nurses. A. Nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training; a staff nurse, a nurse who has completed the training course; charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department; nurse manager, a nurse who is in charge of several wards. Note: the old term sister is still sometimes used for a female charge nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. B. Support workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified but assists nursing staff. There may also be ward clerks, whose duties include making sure patients' notes and information are up to date and answering the telephone. C. Specialization. Like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. D. The nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following article demonstrates. Nurses carry out surgery in effort to cut patient waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts, according to the Scotsman. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Perform, carry out, an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed, carried out by a nurse. Now I'm going to read the exercises of Chapter 7, Nurses. 7.1. Complete the sentences. Look at A, B, and C opposite to help you. 1. Someone who specializes in delivering babies is a midwife. 2. Someone who is qualified to assist nurses is a clinical support worker. 3. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. 4. A nurse who has qualified is a staff nurse. 5. A nurse who specializes in health promotion is a health visitor. 6. A nurse who looks after a ward is a charge nurse. 7. A nurse who works in the community is a district nurse. 8. Someone who answers the ward telephone is a ward clerk. 7.2. Make word combinations using a word or phrase from each box. Look at the opposite to help you. The words or phrases are carry out, change, check, give, remove, sutures, a procedure, an injection, and dressing, the temperature. The word combinations are carry out a procedure, change a dressing, give an injection, remove sutures, check the temperature. 7.3. Complete the sentences with the correct grammatical form of perform. 1. An isotope brain scan is painless and easy to perform. 2. Biopsy of the pancreas performed last March. 3. If the patient's condition deteriorates, a laparoscopy should be performed. 4. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. 5. Last year we performed a randomized, double-blind group study. 7.4. Complete the sentences with the correct grammatical form of carry out. 1. I now intend to carry out a large study. 2. Unfortunately, 3 publicly controlled trials have been carried out so far. 3. A number of studies have been carried out recently to look at this question. 4. A right hemicolectomy was carried out and the patient made a full recovery. 5. The procedure can be carried out in the emergency department. Now I'm going to read Chapter 8, Allied Health Professionals. A. Community health. The health of the community depends on a large number of people other than medical practitioners and nurses. These can be grouped under the heading of allied health professionals. They include the following: physiotherapists, physios, help people to move by getting them to do exercises or treating their body with heat or massage treatment, by manipulating muscles and joints with the hands. We can see more information about physios in Unit 42. Occupational therapists, OTs, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropodists, also known as podiatrists, treat conditions affecting the feet. B. Technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service. An ambulance technician with more advanced qualifications is called a paramedic. C. Prosthetists and orthotists. Prosthetists and orthotists provide care for anyone who needs an artificial limb. A prosthesis or a device to support or control part of the body, and orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacement for patients who had had an amputation or were born without a limb. Orthotists provide a range of splines and other devices to aid movement, correct deformity from an abnormal development of part of the body, for example, clubfoot, talipes, and relief pain. Here we have photos of a prosthesis and here we have a photo of a splint. Now we have the opticians. Opticians retest eyesight and prescribe glasses, also known as spectacles and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, they refer the patient to their GP or general practitioner for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Now I'm going to read the exercises of Chapter 8, Allied Health Professionals. 8.1. Make word combinations using a word from each box. Look at A, B, C, and the opposite to help you. Here are the words: ambulance, artificial, club, contact, health, intraocular, occupational, social. Food, lens, limb, worker, pressure, technician, professional therapist. Here are the word combinations: social worker, ambulance technicians, artificial limb, intraocular pressure, contact lens, occupational therapist, health professional, clubfoot. 8.2. Which allied health professional could best help the following people? Look at A, B, C, and D opposite to help you. 1. A young unmarried woman who has just had a baby. A social worker will be the best to help that person. 2. A woman who is having difficulty using her right arm following a fracture. The best allied health professional will be the physiotherapist. 3. Someone who needs glasses, an optician. will be the best person to help. 4. An elderly woman who has had a below knee amputation. The best allied health professional will be a prosthetist. 5. A man whose wife has Alzheimer's disease. The best person to help the best allied health professional to help this person will be an occupational therapist because Alzheimer's disease is a mental condition. 6. A man with a fungal infection of his feet will be better helped by a chiropodist or a podiatrist. 8.3. Complete the sets. Look at A and C opposite to help you. A prosthetist works with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as a result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without a limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible treatment. Their main aim is to enable the patient to lead a normal life at work and at leisure. An orthotist often works in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity. If damaged, any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. So that was chapters 7 and 8 of the textbook Professional English Use in Medicine. Thank you very much for watching this video.